So I've been looking forward to sharing this particular video with you. I think we've already looked at I can't keep my glasses straight, but I think we've already looked at a video by Dr. Satcher, and I kind of gave you a little bit on on him already. And on the off chance I'm mixing that up with one of my other classes I'm doing voice threads for, Dr. Satcher is a former CDC director and former Surgeon General during Surgeon General during Clinton administration and CDC director prior to that. He, in my mind, at least from what I've read about him, I don't know him personally, but what I've read about him, and he talks about this a little bit in this video, that he was a catalyst to bringing behavioral health into the CDC and into the Surgeon General's office as national health priorities, and is a now he's a bit older. He continues to be a really strong advocate for behavioral health integration into primary care, and he is and he continues to teach and do clinical work through Morehouse School of Medicine and the Grady Health System in Atlanta. He's just a really fascinating guy to listen to. This clip, I really like this clip because he touches on all the things that you probably hear me talk about, or my favorite soapboxes of integrated care and recognition of behavioral care and the inclusion of psychosocial circumstances and structural oppression and social determinants, because they actually do affect people's health in a very measurable and real and physiological way. So that the way we do healthcare today is expensive and not any more sensible from an economic perspective than it is from a human perspective. So anyway, I'll let him tell you the rest of it. I really like this video a lot. Also, as a quick aside, this show called Primary Care with Dr. Lonnie Joe is a neat. You can see up here. It's through public television in Detroit. I don't know if it's still on, but his sole focus, Dr. Joe, is on African American health issues, and as they particularly pertain to primary care. So, if you have an interest in African American health, it looks like most of the episodes are posted through YouTube. So, I think the show seems really kind of well done. If you have an interest in African American health, you might enjoy checking out some of his other episodes of his show. Anyway, sorry for the longer than usual video. This one I'm particularly excited to share with you, and hope you enjoy it.
Just ahead on primary care, less than half of the people in this country who have mental illness will ever seek treatment. I sat down with Dr. David Satcher, the 16th Surgeon General of the United States, to find out why. Later, adult and child psychiatrist Dr. Marika Butler joins me to talk about the mental health crisis happening among African Americans. When we talk about mental health in this country, there's no one who understands the subject better than former U.S. Surgeon General Dr. David Satcher. Dr. Satcher is currently the director of the Satcher Leadership Institute at the Morehouse School of Medicine. I caught up with Dr. Satcher at the African American Museum in Detroit. Dr. Satcher, one of the hidden disgraces of this country is the way that we approach and treat patients with mental health disease, in particular in the African American community. How has this country changed recently? How are we approaching this now? Are we moving the needle on this at all?
Well, Dr. Joe, I would like to think so. As you know, as the 16th Surgeon General of the United States, I released the first Surgeon General's report on mental health in 1998. So we've had much more discussion about mental health and mental illness since then. We have passed 2 Parity Acts, and of course the Affordable Care Act virtually requires all insurance companies to cover mental disorders. It in essence, makes mental health an essential health services. Requires screening for depression, as well as making sure that mental illness is not a justifiable reason for excluding people from coverage. So I think we made progress. However, I think when it comes to our attitudes, we still have a long ways to go.
Yeah, the stigmata associated with it is very prevalent in all communities, particularly in the African American community. Not to mention the provider component,
Yes.
who also needs a timeout and a check on how we actually feel about treating patients and how we try not to separate the head from the body and make it part of the total package in how we treat patients. There's some lag there also in terms of helping providers understand this issue.
Yeah, we do have a provider problem when it comes to mental health. And as you said, we act as if the brain is not a part of the body. We take mental health for granted. I think some of the recent programs integrating mental health in primary care are really showing progress in that area.
Years ago, there were no records even kept on African Americans who had treatment for mental health disease in this country. So just by virtue of the fact that we've become part of the data means that we are making progress. Do you see us continuing to do that, especially from the standpoint of view of helping educate not just providers but the public also?
I do. I think what's going on now in the country, all the way from the way we deal with mental health emergencies to the treatment of mental disorders in primary care settings, which I think is really critical, to really protecting the brain in a way that we have not before. You know, for a long time, we took the brain for granted, whether it was in football or boxing or what have you. Concussions were ignored. So I think there are a lot of ways in which we are making progress, but I also believe we have a long ways to go.
From an academic standpoint of view, 4 years ago you started a program in Atlanta at the famous Grady Hospital that really linked education on mental health with primary care. Tell us about that.
Well, we actually volunteered 4 years ago to take over mental health emergencies at Grady Hospital. I think there were some people who thought that we needed treatment when we did that. But what we've been able to demonstrate, Dr. Joe, in the last 3 to 4 years is that we could reduce waiting time by 80%, reduce the use of restraints, chemical and mechanical, by over 70%, and actually reduce costs by 40%. And many of the patients that we've seen in the emergency setting, we've been able to connect with primary care providers and community health centers. And what we are able to do is to make sure that they have access to whatever level of care they need. So just as primary care is concerned about cardiovascular disease, diabetes, we're now saying that mental disorders have to be a part of primary care. And we have to make sure that every patient who comes through that door is evaluated for mental disorders, but also has access to whatever level of care they need.
Basically telling the story that mental health disorders are treatable.
Exactly.
Which will possibly, and not so in the near future or distant future, we'll be having a conversation about how this disparity changes, because we know that people, from the numbers, people who have mental health disorders usually die earlier and probably don't enjoy the quality of life. But now that we're talking about how this can be treated, we can not only talk about disparities being lessened and bridging those gaps, but also how we save money. That's not a unique thing to us in this business. Everybody's challenged now with how we save dollars. Yeah,
it's especially amazing when we can improve caring and the quality of care, and at the same time save money. And I think that's basically what we've demonstrated. When patients are ignored, when they sit in the emergency room for 10 to 12 hours waiting for a psychiatrist to come, and then they leave and you don't see them again until the next crisis, that's expensive. You know, that kind of recidivism is very expensive. So I think one reason we've saved money is because we really provided quality care to these patients and sensitive care.
Most of the drugs prescribed by physicians in this country for psychiatric disorders are prescribed by primary care physicians.
Right.
So we're looking at shifting the focus a little bit from standpoint of view and saying, hey, this is where you can begin the treatment and begin to continue the treatment by actually having programs associated with primary care where patients can be seen by psychiatrists and psychologists on an as-needed basis.
You know, and that's a very important point. The point here is that these are primary care centers, community health centers, but they have the team approach to care so that every patient has access to the level of care that he or she needs. But the team also trains, it practices, so that when a patient is identified as needing help, the team functions as a team. And there may be a mental health specialist on the team, but the primary care doctor is a key person here, as he or she should be. Because when it comes to continuity of care, when it comes to the whole patient, that's primary care.
You mentioned the Affordable Care Act earlier. This historic legislation, how do you see it actually aiding this whole treatment of primary care and mental health?
I think the Affordable Care Act has led to a major step forward in terms of the opportunities to really provide quality of care for mental disorders. Patrick Kennedy and I have started a partnership really focusing on how can we make sure that what's in the Affordable Care Act is fully implemented for patients throughout this country. Because the Affordable Care Act says that mental disorders are an essential health service, so they should be covered by everybody. Secondly, it says that we have to screen for mental disorders. Screening for depression very early could save a lot of money, but also a lot of problems in the community. And I won't even get into these high-profile shootings and things like that. But clearly, if we do a better job of screening for mental disorders, it's going to help in a lot of ways.
Absolutely. Let's touch on the hot subject of the day, people actually being victims of violence.
Yes.
Unnecessarily in this country.
Right.
And also how that relates to mental health. We're not too far from a county jail where we sit right now. That jail, the sheriff tells me that 40 to 50% on any given day of the inmates in that jail are psychiatric patients, and they're acting out, so to speak, in the community, and people call and complain and they get arrested, and they have a record after that. And the jail basically does not have the charge of treating them for psychiatric illness. Their job is to keep them off the street and keep the community safe. But after a short period of time, sometime overnight, they're returned to the streets to the same kind of behavior. Whereas if we look at what that recidiveness is, you know, we're talking about missing the boat and not making sure that that population get what they need in terms of mental health care.
I think so. We are dumping our mental health problems in this country on the streets of America in terms of the homeless and into our jails and prison. I remember when I released a report in 1998, it turned out it was estimated that the largest mental health facility in this country, even though it wasn't called that, was the Los Angeles County Jail. Because so many of the prisoners in there at any given time were there because they were mentally ill. And the policemen, of course, have to deal with it. They're not prepared to deal with mental disorders. And yet they have to deal with people who are acting out on the street because of their mental illness. So I think you're right. I think without question, the criminal justice system has ended up inheriting this problem in a big way. There's some good examples, though, beginning to develop throughout the country. There are several judges who have made a commitment to, when people come before them and it's obvious that they need mental care, sentence them to treatment and not to prison. And we're seeing more and more of that occurring.
Interesting. Tell me, what made you, what was the turning point in your career that made you become the forerunner and the champion of mental health conditions in this country?
Well, at heart, I'm a primary care provider. Let me just make that clear first. Because I believe that medicine is about the whole person.
Absolutely.
And so that's where I am. However, when I was a medical student at Case Western, And like on many rotations, I was the only black student on this rotation, and it was in psychiatry. And at Case Western, it was called behavioral science, not psychiatry. There was a young black patient, I think he was 16 years old, who was admitted to the hospital, and he was paranoid schizophrenia. And his paranoia was around race. So nobody white could get close to this patient. And so it turned out they were dependent upon me to be able to get in and talk to this patient. For me, what it meant was I had a great responsibility, but I learned a lot about how to deal with a patient with paranoid schizophrenia. There were some days when I went into his room and I had to defend myself because he attacked me. That was not often, but it happened. But the interest in that case was so great until I was actually asked to do grand rounds on this paranoid schizophrenia. And we treated the patient. He was able to go home stable on medications, and then we did the grand rounds. It's always stayed with me for several reasons. I think about all the people who don't have access to a black physician, who actually need it because of their history and sensitivity. And so that really stuck with me. And I think about people suffering from mental disorders and their families and what they go through. And we're seeing a lot of that today. So I think that case had more impact upon me than anything I experienced in medical school. And it stayed with me since. When I became director of the CDC, one of the first things I noticed was that CDC had all of these centers and institutes, chronic disease, infectious disease, etc., but nothing on mental health. So I appointed the first associate director for behavioral health at the CDC. And now we're really trying to get a center on mental health at the CDC.
Changed, raised the level at least
Yes.
for that approach.
That's
Excellent.
exactly right.
Well, the passion certainly comes through for this portion of healthcare. Good. We've been talking with the Honorable Dr. David Satcher, who will always be the 16th
That's right.
United States Surgeon General. Thank you for joining us
Thank
on
you,
Primary
Dr.
Care.
It's great
Thank
being
you.
with you.
Great. Thank you for having me.